All right, today we're putting on our detective hats. We're diving into the world of radiology to solve a mystery involving two very common but often misunderstood shadows that can show up on your bones. Let's get right to it. So, picture this. You go in for an x-ray, maybe for a totally unrelated reason, and the doctor comes back, points to the image, and says, "See that shadow right there on the bone?" I mean, talk about an immediate spike in anxiety, right? Well, that exact moment sets up the mystery we are going to unravel today. So, what is this shadow we're talking about? Well, a bone cyst is basically just what it sounds like, a fluid-filled sac inside a bone. Now, the key word on this slide, and it's a really important one, is typically. This tells us that these are almost always benign, which means non-cancerous. But it's not a 100% guarantee, and that's exactly why getting the diagnosis right is so critical. Okay, so in our diagnostic mystery, we've got two main suspects that we're going to investigate. Let's meet them and check out their profiles. First up, we have suspect number one, the simple bone cyst, or SBC for short. You'll often hear this called the only true cyst of the bone, mainly because it's just a simple, single cavity filled with fluid. You can think of this one as the strong, silent type. It usually shows up alone, doesn't cause a fuss, and often heals all by itself as a person gets older. And our second suspect is the aneurysmal bone cyst, or ABC. Now, don't let that name fool you. It has absolutely nothing to do with an aneurysm in a blood vessel. It gets its name from the way it grows. It's dramatic, it's expansive, and it literally causes the bone to balloon outwards, which, as you can imagine, looks pretty intense on an x-ray. All right, we've met our suspects. Now the real investigation begins. We're going to put these two side by side, compare their MOs, and hunt for the clues that tell them apart. Now this table right here, this is where we see the core differences. First, notice the age. Both are common in young people. But look at the structure. The SBC is unilocular. That's just a fancy way of saying it's one single chamber, filled with clear fluid. The ABC, though, is loculated, meaning it's divided into multiple little cavities. And here's the kicker, they're filled with blood. So one is like a simple water balloon, the other is more like a blood-soaked sponge. Big difference. In any investigation, location is a huge clue, right? Well, for simple bone cysts, their address is a dead giveaway. A whopping 55% of them are found in the proximal humerus. That's the top part of your upper arm bone, right near the shoulder. Another 26% pop up in the proximal femur, the upper thigh bone, close to the hip. And if we want to get even more specific with a location, both of these cysts love to hang out in a part of the bone called the metaphysis. So what's that? It's the active, growing part of a long bone in kids and teens, kind of sandwiched between the end of the bone and the long middle shaft. Think of it as a busy construction zone for bone growth, which makes it prime real estate for these cysts to form. Now, let's check the map for our other suspect, the ABC. The locations are just a little bit different, but it matters. While it also likes the metaphysis, you're most likely to find an ABC in the distal femur, that's the bottom of the thigh bone by the knee, and the tibia, your main shin bone. See? Subtle differences, but for a detective, they're critical clues. Okay, now we're getting to the heart of it all. This is where we find the smoking gun. The most definitive evidence always comes from looking directly at the X-ray, the radiograph itself. This quote just nails it, doesn't it? An X-ray is so much more than a picture. It's a story written in shades of black and white and gray. The trick is just learning how to read the language. And for these cysts, there are some very specific words that give them away. So on a very basic level, both of these cysts show up as what doctors call osteolytic lesions. That's a technical term, but all it really means is a dark spot on the X-ray where bone has kind of been eaten away. So at first glance, they can look pretty similar. But now we look closer for those telltale signs. And here it is, the absolute classic slam dunk clue for a simple bone cyst. If the bone around the cyst gets thin and fractures, a little piece of the hard outer shell, the cortex, can break off. And because it's in a fluid-filled sac, it just falls to the bottom. On the X-ray, you can see this little chip of bone just sitting there. It's called the fallen fragment sign, and it's a dead giveaway. The other huge clue for an SSB is its position. It's concentric, which means it likes to set up camp right in the middle of the bone. Any swelling or expansion it causes is usually nice and symmetrical, kind of like you blew up a tiny balloon perfectly in the center of a tube. Now let's look at the aneurysmal bone cyst. Its signature look is way more dramatic. Radiologists often describe it as having a blown-out appearance. You can see how it just balloons aggressively outward, pushing that outer layer of bone into a paper-thin shell. And why does it look like that? Well, because unlike the SBC, the ABC is eccentric. It grows off-center, closer to the edge of the bone. So instead of that nice symmetrical expansion, you get this huge bulge pushing out to one side. So that's the bottom line. SBC is central and quiet, ABC is off-center and explosive looking. So, with all our evidence gathered, we've pretty much cracked the case. We've reached the resolution. Now let's talk about what this all means for a patient and how these things are actually handled. You know, the wild thing is, most people with these cysts have no clue they're there. They're usually completely asymptomatic. No pain, no nothing. They're typically found by total accident on an X-ray or, in a more dramatic way, after the weakened bone leads to what's called a pathological fracture. This means the bone breaks from a minor bump or fall that normally wouldn't cause any damage at all. But wait, there's a plot twist, at least when it comes to the ABC. While about 80% of them are primary, meaning they just pop up on their own, a full 20% are actually secondary. And what that means is that the cyst itself is being caused by a different pre-existing problem in the bone. And this is why getting the diagnosis right is so important. A secondary ABC isn't the real villain. It's just a symptom. It's a signpost pointing to another underlying issue, like a giant cell tumor or a condition called fibrous dysplasia. So spotting the ABC is just step one. The real detective work is figuring out if something else caused it. So what's the resolution here? Well, for a lot of small cysts that aren't causing any problems, doctors might just keep an eye on them. But if a cyst is big or painful or looks like it might cause a fracture, then treatment is usually surgery. The standard go-to is a procedure called curettage and bone grafting. A surgeon goes in, carefully scrapes out the lining of the cyst, and then fills that empty space with bone graft material. That graft acts like a scaffold, helping new, healthy bone to grow and fill in the hole. So, to wrap up our entire investigation in one simple takeaway, here it is. The simple bone cyst is the quiet tenant, living neatly in the center of the bone. The aneurysmal bone cyst is the loud, eccentric neighbor blowing out the wall from the side. Two totally different stories, all told by the shadows on a single X-ray.